Hi everyone, welcome back to my YouTube channel. Today we are going to talk about osteosarcoma. So let's start our topic with introduction. Osteosarcoma is highly malignant primary bone tumor characterized by production of osteoid or immature bone by malignant mesenchymal cell. It is the most common primary malignant bone tumor in children and young adults, although it can also occur in older adults. In the head and neck region, osteosarcoma typically affects the mandible and maxilla, representing less than 10% of all osteosarcomas. Osteosarcoma in the jaw often present later than in the long bones. It has slightly better prognosis, but it is still aggressive due to local invasiveness and potential for metastasis. Definition of osteosarcoma. Osteosarcoma is defined as malignant neoplasm of mesenchymal origin that produce osteoid bone or both, with potential for local invasion and distant metastasis. Etiology of osteosarcoma. The exact cause is often unknown, but several risk factors have been identified. They include genetic factors, that is, mutation in p53 gene and RB1 gene. It is associated with Life-Fraumeni syndrome and hereditary retinoblastoma. Second etiology is radiation exposure, that is, because of previous therapeutic radiation that increased risk of osteosarcoma. Third cause is bone disorders like Paget disease of bone in older adults and fibrous dysplasia that cause rare malignant transformation. Fourth etiological factor is age and sex, as it is most common in adolescent and young adults that are between 10 to 25 years of age, and it has slight male predominance. Fifth is rapid bone growth. Tumor often occur in metaphyseal region of long bones due to high osteoblastic activity, but it in jaw may involve areas of active bone growth. Pathogenesis of osteosarcoma. Osteosarcoma develops due to malignant transformation of mesenchymal cells that are capable of osteoid production. First is genetic mutation, that is because of loss of tumor suppressor function, that is because of p53 gene and RB1 gene. Second is abnormal cell cycle regulation, that is uncontrolled proliferation. Second pathogenesis is osteoid formation, that is when malignant cell produce immature bone or osteoid matrix and it causes local bone expansion and destruction. Third step in pathogenesis is local invasion, that is when tumor infiltrates cortical bone, periosteum, and adjacent soft tissues. It may elevate periosteum, causing sunburst appearance on imaging. Fourth step is metastasis, that is when hematogenous spread is occurs, and it is common that with osteosarcoma. Lungs are the most frequent sites of metastasis, and lymph nodes involvement is rare in the case of osteosarcoma. Clinical features. First are general symptoms that include pain and swelling at the tumor site. There is rapidly enlarging mass and loosening of teeth if jaw is involved. Second feature is associated with oral and maxillofacial presentation, that mandible is more commonly affected than maxilla, and swelling of jaw with firm or hard consistency is there. There is facial asymmetry, possible ulceration of overlying mucosa in advanced cases, and numbness if inferior alveolar nerve is involved. Then there are systemic symptoms that are rare in early stages. They may include fever, weight loss, and fatigue in advanced or metastatic diseases. Histopathology of osteosarcoma. First is malignant mesenchymal cells producing osteoid and immature bone cell. There is high cellularity with pleomorphic spindle or polygonal cells. Mitosis often is abundant in area of osteosarcoma. Subtypes include osteoblastic osteosarcoma, chondroblastic osteosarcoma, and fibroblastic osteosarcoma. Osteoblastic osteosarcoma, there is prominent osteoid. In case of chondroblastic chondrosarcoma, there is cartilage formation, and in case of fibroblastic osteosarcoma, there is spindle cell predominance. Diagnosis of osteosarcoma. First is clinical examination, that includes palpation of firm mass and assessment of jaw mobility and mucosal involvement. Second is imaging, can be done for diagnosis, that include radiographs, CT scans, and MRI and biopsy. Radiographs show radiopaque and radiolucent areas that are called as sunburst pattern and cortical destruction. CT scan involve bone involvement and extent is shown in CT scan. MRI shows soft tissue extension and marrow infiltration. Biopsy confirms malignant osteoid production, and it determines histological subtype and grade of osteosarcoma. Differential diagnosis of osteosarcoma include fibrosarcoma, chondrosarcoma, osteomyelitis, Ewing sarcoma, and malignant fibrous histiocytosis. Cytoma. Management of osteosarcoma. First we do is surgery, that is mainstay of treatment. There is wide resection with tumor-free margins, and jaw reconstruction is done often required post-excision. Second, we can do is chemotherapy, that is important for long-term bone osteosarcoma. That is also used in jaw lesion if high grade. Agents for chemotherapy include doxorubicin, cisplatin, and methotrexate. Then we can do is radiotherapy, that is generally radio resistant. It is used for unresectable tumors or palliation. Fourth, we do is follow up, that is regular imaging to detect recurrence or metastasis. Pulmonary evaluation of metastasis is also done. Prognosis of osteosarcoma. Jaw osteosarcoma generally have better prognosis than long bone tumors. Prognosis depends on tumor size and grade, completeness of surgical excision, histological subtypes, presence of metastasis. Local recurrence is the main cause of treatment failure. Complications of osteosarcoma. First is local recurrence. Second is special deformity after surgery, especially when it is involving jawbone. Third is functional impairment like in chewing and speaking. Fourth is pulmonary metastasis, and fifth is rare neurological involvement if nerves are invaded. Conclusion of this lecture video. Osteosarcoma is a malignant bone tumor producing osteoid that is capable of local destruction and metastasis. Early detection, aggressive surgical excision, and in selected cases chemotherapy are essential for improving prognosis. Jaw osteosarcoma, although rare, require multidisciplinary management for optimal function and cosmetic outcome. And this was all about osteosarcoma. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.